You have high blood pressure? Well, you're not alone. Nearly half of all Americans have hypertension, or what we commonly call high blood pressure. In this video, we're going to discuss what blood pressure means and what is hypertension. I'm Jessica English, a registered nurse, and this is Just a Nurse Talks. For your body to be able to survive, it needs oxygen. Oxygen is delivered by your blood through a complex piping network known as your cardiovascular system. The main organ inside this system is your heart. Now, your heart functions to push blood from one area to another. It does this by squeezing itself together and forcing blood into your arteries, and then relaxing and allowing itself to refill. During this process, there's pressures created inside those arteries. These pressures are what we measure to determine what your blood pressure is. This is the number that's created when your heart relaxes. When discussing blood pressure, there are two numbers that we are talking about. First, or top number, is your systolic blood pressure. This is created when your heart squeezes and forces blood into the arteries. The second, or bottom number, is your diastolic blood pressure. This is the pressure in the arteries when your heart is refilling and relaxed. There are 5 classifications that blood pressures fall into. First is a normal blood pressure range, which is 120/80. Second is an elevated blood pressure that's 120 to 129 systolically, or your top number is running 120 to 129. Stage 1 of hypertension occurs when your blood pressure consistently runs 130 to 139/80 to 89. Stage 2 occurs when it's consistently running 140/90 or higher. There's also one more classification. It is a blood pressure range that is extremely dangerous. When your blood pressure is getting toward the higher side of, say, 180/120, this is what we call a hypertensive crisis and needs immediate medical intervention. The exact reason you have hypertension is unknown. There are many genetic and lifestyle factors that contribute to this diagnosis. 2 main classifications for this diagnosis is essential hypertension and secondary hypertension. Essential or primary hypertension occurs when your body just naturally maintains a high blood pressure. You see, your body is able to adapt to whatever it's experiencing. This often leads you to not being able to feel what's going on inside your body. And in these situations, there's damage being done that you have no idea that's happening. Secondary hypertension occurs because your body has another factor that's creating a high blood pressure within inside it. Many chronic illnesses will lead to this, such as diabetes, thyroid, sleep apnea, heart disease, high cholesterol, and so many more that it would take a lot to list. So what does high blood pressure do to your body? Well, your arteries are small vessels with little muscles around them. And as that pressure increases, it damages those muscles, damaging your blood vessels. Over time, they'll thicken, causing what we call hardening of your arteries and further increasing your blood pressure. As this occurs, we have damage to our small blood vessels, such as our eyes, the ones in our feet, the ones in our kidneys, leading to a lot of other disease processes.
Here are a few tips to help you manage your blood pressure.
Tip 1, get a doctor. The diagnosis of hypertension is complex and complicated and requires close medical monitoring. It's not a disease that you're ever cured from. It is constantly changing the normal state of your body into a very reactive system that is setting you up for further problems down the road and other chronic illnesses. So please, get a physician that you feel comfortable enough talking with, someone you can be honest about what's going on in your life and what are the factors that might be creating some of the issues that you have. Tip 2, stop your salt. You see, salt is inside our body and it's what we move fluid with. It's also something that doesn't leave our body once it's in there. So how does salt move fluid? Well, a process called osmosis, where water wants a partner inside the body. So it'll move from an area where there's very little salt to an area where there's high salt. This is how fluid moves outside of your bloodstream and to surround your cells. This actually causes swelling or edema and increases your blood pressure. Your daily allowance of salt is less than 2.3 grams per day. and that's only a teaspoon of salt. Tip 3, get moving. I was with a physician once who told me he can essentially rebuild a person's cardiovascular system by increasing their activity. Well, that's activity that increases your heart rate. How does this happen? Well, the best example I have for you is if you have a 52-year-old man and a 72-year-old man, and let's say they're exactly the same except for their age, same disease process, same everything, and they both have the same kind of heart attack, the 52-year-old will die from that heart attack where the 72-year-old won't. And that's because his body grew new blood vessels to protect him because he already had damage. So you remember back in science class when they taught you that whole theory about an object in motion stays in motion? Well, the same thing goes with your body. A body in motion stays in motion, but a body at rest stays at rest. Thank you for watching. I hope you found this video informative and helpful. And if you have, please hit the like and subscribe button down below. It will help me bring more content to you. Also, I'm open to questions. Please leave them in the comments down below. I'm Jessica English, a registered nurse, and this is Just a Nurse Talk.